All right, let's talk about assessment. I'm going to use a really simple approach here and talk about the 5 W's of assessment. So we'll talk about what is assessment, who's assessed, when, where, and why are people assessed for communication or swallowing disorders. Let's break apart the definition from your textbook to get started. So assessment is the systematic process of obtaining information from many sources through various means and in different settings to verify and specify communication and swallowing strengths and weaknesses, identify possible causes of problems, pardon me, and make plans to address them. So the first box tells us what we're doing when we assess. So in speech language pathology, assessment is definitely a systematic process. It's carefully planned and has specific goals. And the rest of the what tells us how we do that in terms of we use a variety of sources, means, and settings. We're looking to capture communication in a broad way to really clearly describe the person's communication profile. And the why, we have specific goals when we're assessing. We want to verify and specify communication swallowing strengths and weaknesses. We want to be able to robustly describe what we're seeing. Typically, this is for purposes of things like diagnosis. We want to be able to identify causes and make plans. Let's talk about that now. So a little bit more about why we do assessment. There are really 3 main purposes. The first you could think of as problem, no problem. Is there actually a communication disorder here? That's often the purpose of a first assessment. And often what goes with this is diagnosis or applying a label to a disorder if it's identified. Along with diagnosis, again, we're looking to really clearly describe a communication profile. We want to know what this person can do, what their participation is like, and so on. An extension of that is differential diagnosis. This refers to the fact that there can be a variety of similar presentations, and we want to be able to apply the most appropriate label to this person if that's a goal of our assessment. The next purpose of assessment is etiology. That's describing causes and underlying factors. So think about our case study, Jake. We may not know biologically what caused him to have difficulties with language development, but we can certainly think about some of the underlying factors for his language difficulties. We talked a little bit, for example, about the mismatch between his language abilities and the environmental context that he was in. A third purpose of assessment is treatment planning. We want to be able to use the information we know about this person's communication to select appropriate goals and to begin to plan an appropriate plan of intervention. And one of the types of tools we might use here are methods of dynamic assessment. Dynamic assessment is interesting because we measure a skill and then we actually provide some teaching and then we measure the skill again. And this can tell us things like how changeable is the skill, what kinds of cues are helpful, and so on. And you can think about how that would be really helpful if you're actually looking to set up a treatment plan for somebody. So when an assessment happens is really a big question. Realistically, a difficulty is observed by somebody such as an SLP, teacher, doctor, parent, the client themselves. And once that difficulty is observed, then the person is referred to an SLP for a screening or for an assessment. A screening is a specific kind of assessment, the purpose of which is to say, does everything look like it's okay here, or do we need further assessment? So if a person doesn't do as expected on a screening, it doesn't actually mean there's a disorder there. It just means there's a need for further assessment. And I think it's important to think about that because earlier on we talked about the role of the SLP in prevention, and I mentioned screening protocols. Those are screenings that actually happen before any needs are actually identified. They're broad-based screenings, an example being universal newborn hearing screening. So the goal is to identify as early as possible any risks of difficulties or any signs of early difficulties so that ideally we can prevent further problems later on. When we think about when a speech language assessment can occur, I also wanted to remind you that speech language assessments can actually occur at any stage of life. So that's another really interesting aspect to the practice of speech language pathology. There's not a certain age group of people we work with. Communication is something that affects us our whole lives. Feeding and swallowing affects us our whole lives. So we could be working with somebody at any stage of life, from early infancy to elderly adulthood. Another really interesting aspect of the practice of speech language pathology is we can work in many different settings. So it could be health unit, hospital, and so on. And the factors that determine where the service occurs are things like what is the area of difficulty. So obviously, if you're dealing with somebody who's very ill, you may well be working in a hospital, but SLPs routinely work in schools as well. So what is the condition? What is the age of the person? Is this a rural or urban setting? And so on will all determine where the service happens. Let's talk about um, assessment processes, and we'll talk about them in terms of three main phases. So the first is referral and pre-assessment, then assessment, and then moving on to interpretation and reporting. In that referral and pre-assessment stage, we're gathering information that we use to structure the later assessment. So if this person is a returning client and we've seen them before or somebody else has seen them before, we're usually going to do a file review. So we look at the file and we examine information that's been collected about them before. We'll probably do an interview with the client or family to gain more information, to ask questions we may have after we do the file review, and very often to gather or update their case history. And the case history is usually a set of questions that are designed to get information that's expected to be relevant. So for example, with children, we're interested in things like developmental milestones. Once we have all that early information, we understand the basic question: why has this person been referred to us? What has been observed, or what is the perceived area of difficulty? And we've identified what the purpose of our assessment is, and that allows us to structure our assessment the most efficiently. When we do our assessment, we're going to use various tools like standardized tests. We can use observations. We can use something called criterion referenced probes. And those are activities that sample specific skills and will set a criterion of success based on things like developmental expectations. Once we've gathered all that information, which again is going to come from different tools, different sources, different locations, we're going to do some interpretation because we have a lot of information we've gathered, and our goal is to actually come up with a cohesive communication profile for this client. So that's interpretation. Usually once we've done that interpretation, we're going to report it in some way. Once we've done our interpretation, we should have a cohesive description of the person, and we should be able to make that diagnosis. Typically at this point, we're also making recommendations. So those will follow from the purpose of the assessment, and very often will include things like whether we think this person would be appropriate for therapy or whether they need to be referred on for other services. We'll also write a prognostic statement in most cases, and that's a statement that tells what we think the likely progression of this communication or swallowing disorder will be. And it's based on things like the person's age, previous response to therapy, supports they have in their life, known risk factors, and so on. Part of this reporting phase is usually some early treatment planning. So for example, in our recommendations, we might identify some potential treatment goals. As we move forward into therapy, we'll do some progress monitoring. And that's another kind of assessment that actually happens throughout the intervention phase. And we'll talk about it a little later on when we talk about intervention. I want to mention how important it is to consider cultural and linguistic diversity when doing speech language assessments. We need to realize that the methods we use should be sensitive to the client and family perspectives. And we need to understand that some materials we use may actually have inherent bias. So for example, if I'm talking to somebody about their child-rearing practices, I need to be careful that I'm not making assumptions based on my own family history or my own knowledge of child-rearing practices, perhaps in the majority culture where I'm from, because they may well be different from that family. And again, differences aren't wrong, they're just differences. However, you can make incorrect assumptions if you don't realize that there is a bias at play. So one of the SLP competencies is being aware of one's own biases and being able to mitigate them. It's really important to understand the concept that a language difference is not a language disorder. If we don't acknowledge that, we can interpret things inappropriately and actually come to the wrong conclusions. So for example, we need to understand the test materials we have. If they are designed for monolingual English speakers, for example, and we have somebody who comes from a different language background, that test is probably going to give us incorrect results for that person. Also, there can be cultural bias. So again, if a test is written for a specific majority culture, the images in the test or the knowledge assumptions in the test might be a mismatch with the person you're working with. You need to recognize that ahead of time and realize that instrument is not appropriate to use with this person. If you have a family, for example, where they don't speak the majority language, in our current situation, English, you might need to consider use of interpreters. And you would need to think about whether the interpreter has the appropriate training to mediate something as complicated as a communication assessment. I want to highlight some resources that are available through University of Alberta. So if you go to the U of A webpage and you look up the Chesil Center, you'll find a collection of materials that was collated and developed by folks here at University of Alberta. And these are methods that are designed to work cross-linguistically. So we do have measures and methods that we can use that are more sensitive and more appropriate for clients who aren't from the majority culture or linguistic background. And I want to talk briefly about using varied assessment procedures. So we talked about how we use all these kind of different tools. And one of the ways we can think about our tools is on a continuum from naturalistic to structured. Let's think about some examples from the textbook to think about this continuum. The textbook talks about collecting authentic real life information. That would be the most naturalistic kind of information. So it is real life, actual communication behaviors. Things like case histories, questionnaires, and interviews are still quite naturalistic, but there's some structure built in there that is one step removed from normal day-to-day communication. Let's skip down to norm reference tests. Standardized tests are designed so that they're delivered exactly the same way to each person, and that's really important. They need to be delivered that way so that we can compare the performance of the person we're working with to a large sample of their peers, and that helps us with our interpretation. That is the most structured kind of tool. And it's really useful for what we need it for, but it's not a good representation of normal communication behaviors. And that's why we're using tools that are on that continuum and realizing that different types of tools on that continuum have different purposes. And using naturalistic to structured tools helps us get a broader view of a person's communication profile. All right, we're going to pause there. That's the end of our chat on assessment specifically, and next we'll talk about intervention.